Welcome to The Explainer. Today we're diving into a fascinating medical mystery, a single problem in the heart that can quite literally split a person's body in two. It's a dramatic story of pressure, struggle, and incredible resilience.
So let's just jump right in with a really strange puzzle that doctors sometimes have to solve. Imagine a patient walks in and their body seems to be living two completely different lives at the exact same time. I mean, how is that even possible?
Well, take a look at this. The patient's upper body, we're talking arms, head, chest, it's doing great. It's warm, blood pressure is high, pulses are nice and strong. But then you look at the lower half, and it's a totally different story. It's starved for blood, the pressure is low, the pulses are weak, and the legs might even look cold and discolored. It's truly a person divided right down the middle.
So what in the world could cause such a bizarre split? You might think it's a bunch of different problems, but the answer is actually a single blockage on the body's main superhighway for blood.
The condition is called coarctation of the aorta. Now that's a mouthful, but it's something a person is born with. All it really means is that there's a severe pinch or narrowing in the aorta, and the aorta is the biggest, most important artery in your body. So think of it like a 4-lane highway that suddenly gets squeezed down to a tiny 1-lane exit.
And here's the kicker. Where this pinch happens is everything. It's almost perfectly placed just after the major arteries that feed the head and arms have already branched off. This means the upper body gets all the high-pressure blood at once, while everything downstream, the entire lower body, is left fighting for whatever trickle can make it through that roadblock.
Okay, so we've got a blockage. But how does that one little pinch set off such a dangerous chain reaction? Because this isn't just a flow problem, you know? It's a massive pressure crisis.
You can really see the domino effect right here. First, the aorta narrows, creating this huge wall of resistance. To push blood past it, the heart's main pumping chamber, the left ventricle, has to go into overdrive, contracting with incredible force. And the result? The pressure before the blockage just skyrockets, while the pressure after it completely plummets.
So you have to ask, right? This insane pressure difference has to take a toll on the body. So who ends up paying the price for this constant battle?
Well, the first and biggest victim is the left ventricle itself. Just like any muscle you overwork at the gym, it gets bigger. It thickens up from constantly fighting that blockage. But here's the thing. A thicker heart isn't a stronger heart. It actually becomes stiff and inefficient, and over time it can just fail. And when the left side of the heart fails, the whole system is in serious trouble.
And believe me, that crazy high pressure in the upper body isn't just some number on a chart. It causes real, tangible, and dangerous problems. Patients often show up with severe headaches, frequent nosebleeds, blurry vision, all the way up to a life-threatening risk of a stroke or a bleed in the brain.
So if the main highway is blocked, how does the lower body get any blood at all? I mean, how does it even survive? Well, this is where the human body reveals its absolutely incredible ingenuity.
It's almost unbelievable, but the body literally builds its own bypass. It opens up this whole network of small, sleepy little arteries that doctors call collaterals. These vessels create a detour, a whole system of backroads that takes blood from the high-pressure zone before the blockage and cleverly reroutes it to the low-pressure zone after it.
And we're not just talking about a little trickle here. This rerouted blood flow is a powerful torrent. Over years, these pulsating, enlarged arteries are so strong they can physically wear away the bone on the underside of the ribs. This creates these visible notches that you can actually see on an X-ray. It's a classic telltale sign of coarctation known as Rossler sign.
But you know, a sharp doctor can often spot this condition long before they even order an X-ray. And they can do it with a remarkably simple physical exam. It all just comes down to feeling the pulses.
So a doctor will put one hand on the radial artery in the wrist and the other on the femoral artery down in the groin and feel both pulses at the exact same time. Now, in a healthy person, they hit simultaneously, but in someone with coarctation, the strong bounding pulse in the arm arrives noticeably before the weak, delayed pulse in the leg. That little time gap is called radiofemoral delay, and it's a classic clue that something is wrong.
All right, so we get the problem, we see how the body tries to cope, and we know how to find it. So what's the next step? How do doctors actually go in and fix the root cause?
Well, there are two main strategies. The traditional method is surgery, where a surgeon physically goes in, removes that narrowed segment, and then sews the healthy ends of the aorta back together.
A more modern, less invasive option is to thread a catheter up to the blockage and deploy a stent, which is basically a tiny mesh tube that expands and props the narrowed artery open from the inside.
But here's the thing, and this is so important. No matter which repair is done, the single most critical, lifelong issue for these patients is managing their blood pressure. It was the central problem from the very start, and it remains the central challenge to prevent long-term damage to the heart and the rest of the body. So, when you take a step back and look at this whole story, this tale of two bodies, what's the big takeaway? What does a rare condition like this reveal about how our bodies fundamentally work?
It teaches us that the body is not just some passive machine. It is a brilliant and resilient system that is actively fighting to survive. Faced with a catastrophic failure on its main supply line, it doesn't just give up. It adapts, it innovates, and it builds its own solution. It's really a powerful story about the constant, incredible battle for balance that's happening inside all of us.